We've seen a lot of Hollywood looking kind of crazy. People are afraid of that, and I think they think that one syringe of filler is going to give them that look, but really it's like it's not going to give them that look.
Dr. Azizi, world-renowned plastic surgeon.
Look at what your injector looks like too. If your injector has really nice skin, nice cheeks, nice eyes, not a lot of
their mindset of what they would give you.
Yes, right. Exactly. And it's what their taste is, right? The problem with BBL is many surgeons just inject the butt. They don't inject the hips or the transition zone to the thigh. So you get this butt that's much bigger than the thigh. And that's what looks weird to the eye. When we do a tummy tuck or lipo, no one ever says that they're too skinny. You can make people as skinny as possible and they're gonna still be like, but what about these ribs? In the last year or two, AI is now popping up. So I'm getting wish pics of AI people. And I'm like, not only does that person not look like that, I used to say like that girl doesn't look like that. Now I have to say like that person doesn't even exist.
Rib reduction. Can you give us a little insight on what this is? Welcome back, everyone. It's Sam Patel. Super excited to have you here with us today because today is going to be a very exciting one. If you're new here, make sure you hit subscribe. We cannot miss each other in the content that we distribute with all the knowledge to make your industry, the aesthetics and wellness, and now surgical discussion better every single day for you and also your patients. I'm very blessed and honored to have an amazing guest, Dr. Azizi, world-renowned plastic surgeon from our hometown here, Chicago. Right. Dr. Azizi, pleasure to finally meet you in person. How are you?
Thanks. Good. Thanks. Pleasure, man. I've been following you online for a long time. Seeing you today for the first time in person. It's crazy, but I'm happy to be here, man. And there's so much to talk about.
Well, I'm excited to have you as well. We're going to be discussing, your field, your expertise. And this is the first time we're having an actual board certified plastic surgeon on the show today.
Awesome.
And I'm excited because this is an area that is emerging more and more. And a lot of the context and focus that nowadays is on med spas and, minimally invasive. But hey, surgery is still a thing.
Yeah.
And plastic surgery is still important. And I'm glad that we have you because this is such an important discussion. And I have a lot of things I'm going to pick your brain about. So I hope you're ready.
Yeah.
We're going to be diving in. And one of the things that I want to kind of really focus on is actually just learning more about you, right? I think that it's so important for our viewers to know who you are, but also plastic surgery and what it's come to be. So let's hear a little bit more about your background. I know you're a native here to Chicago. So for all the Chicago fans out there, make sure you follow him. But nonetheless, let's hear what your story is.
Born and raised in Chicago. I'm a board certified plastic surgeon. I did general surgery and fellowship training in plastic surgery for all those, science nerds that know how long the thing is. And then I started my practice right out the gate about 9 years ago. So I'm 9 years in solo private practice, no business training. Basically, there was no jobs out there. And I had to take a loan out and hang a shingle, kind of old school way, right?
Yep.
And had a small office. I remember the first person I hired who was like my receptionist, I could only have her for part-time. I was like, I don't even have a full-time position. And then slowly, just one day at a time, just kind of grew, just tried to take care of my patients, do good surgery, customer service, all that kind of stuff, right? A few years ago was able to build out our own surgery center and high-level kind of office. So we are a boutique, high-level plastic surgery office. I do primarily cosmetic, breast, and body contouring. I got known for my BBLs over the years. I do high-definition lipo, tummy tucks, breast work, that kind of thing. And then over the last couple of years, we've actually expanded what everyone knows now is like wellness stuff. But for me, it was just an extension of recovering patients for surgery. So I kind of got into that because I was like, well, I should have a lymphatic massage person because I keep referring people out for that. And I was like, well, I go down to Colombia and I see they're doing hyperbaric oxygen. I was like, well, I should get a hyperbaric chamber because that's going to help people recover. Because a lot of it was just problem solving for people with surgery, right? Because people are always worried about recovering. And I was like, well, how can I problem solve and make things easier? Well, if I provide the massages, easier. Hyperbarics to heal people quicker, easier. Red light, okay. Start using science and stuff like that to recover people easier and take away this kind of more scarier part of surgery, the recovery part, and make it better. And we try to be very quality over quantity. We're very hands-on, very customer service oriented, that kind of stuff.
It sounds very comprehensive because usually people go to a plastic surgeon, get the surgery, and then that's kind of it, right?
Yeah.
And it sounds like you are really focused on what happens afterwards. How can I have them recover better and recover faster, which ultimately probably obtains a better result for them too, I assume. And it's also in your sort of monitoring. You're monitoring it. You're providing these sort of hyperbaric chambers and post-recovery, the wellness. This wellness integration is actually intriguing to me. That's my space. I love wellness. I love wellness and aesthetics. Before, we used to kind of see these two worlds separately. There would be aesthetics and sort of cosmetics and let's just say surgeries over here too. And then there was wellness. And there were just kind of two universal lands that have now merged together. You're starting to see that and you're also practicing that. Why do you feel that's so important now?
There's so much stuff, I think, in society and politically and people's interest over time. Over the last 5 years, it's kind of like shifted into holistic wellness and away from Western medicine, back to Western medicine, this kind of stuff. So for me, just to kind of take it back, and I promise I'll get back to the answer. But so I built up the whole surgery side of things, and I was trying to make things easier for surgery patients, right? So this is how we got into thinking about what else can we do, problem solve, bring in lymphatic massage, bring in hyperbarics, all this kind of stuff, right? And then I was kind of maxed out for surgery at my practice, and I was like, well, I need to do other stuff and I can't do more surgery. So what other things can we bring in to solve things for patients? And you're right. This started by getting the massage person, because if I have the people doing the massages, their results are better, makes me look better. And people who don't have the massages, they don't look as good. And so it is self-serving, but then the patient gains it. And then if you can bundle that in with surgery and you have a high-level massage person at your clinic, there's no excuse for not to get it. So it's a win-win-win, right? For kind of everybody. And then when people come for a consult, they feel like with all these things bundled in, number one, they can't unbundle it and pick you apart on price because everything's all in there. Number two, they know that you care because you're invested in their post-op, and like not a lot of people are, right? So it becomes a differentiator. So the hyperbaric chamber, very few surgeons or people in general have a hyperbaric chamber, you know? But a hyperbaric chamber is $60,000 and everyone's spending $120,000 on equipment left and right, but no one thinks about this like other thing that has like no consumables and it helps you to kind of recover patients quicker. Fine. So I got that. It was a differentiator. Cool. And then I was like, well, do I need to do Botox and fillers? Because every plastic surgeon's like, well, do I need to do this stuff because, you know, lifetime value of the patient, I should do this, it's a moneymaker, and you know, but I had always just spent time on surgery and building the surgery side of things because I think focusing is important. You know, if you're spread thin and you're trying to do a Botox consult and filler consult and a surgery consult, when your zone of genius and your highest impact and what you can make revenue wise and help people is through surgery, like myself, then I do surgery, right? So if someone who's dermatologist has a different version of that, someone who's family medicine has a different version of that, right? So the family medicine person may find an interest in functional medicine, which makes more sense with wellness. Whereas for me, it makes sense to do more surgery. And then I actually got certified in functional medicine last year because I got interested in all this stuff. But anyway, so how does like wellness come about? So I'm like, all right, well, med spa stuff seems really competitive. I don't know if I want to go play that Botox and filler game with people. All these dentists are doing it, family medicine's doing it, everybody's doing it, right?
Everybody.
MBAs are doing it, like private equity, right? So I was like, oh man. And then I was like, well, what can I do for my patients, right? So I wanted to be like, well, can we just continue to expand these things that are science-based to help people recover better? So it was like hyperbarics. Then I got the red lights because red lights are proven to help recovery. Scars are better. People feel better after surgery and stuff. We're just about to launch an IV bar because like that'll help to hydrate patients, and I can do anti-inflammatory, antioxidant medicines to kind of help them feel better and stuff. And of course, hydration after surgery is good because you're dehydrated, right? So I think part of it is you have to look at what are you referring out to constantly. We kept referring out microneedling for scars. And then no med spas would do it because they're like, they don't feel comfortable doing microneedling on scars. They do it fine for the face. So I was like, oh, we got to bring this in-house, right? So if you find that you keep saying like, you keep referring out, that's a service that you need to think about bringing in. If you're like, man, I wish we had this thing that would help our patients, that's a service that you bring in. And bundle it in with the other stuff, right? Whether you're doing surgery or you're doing tailored kind of treatment plans, like I know you like to do for people. That's a big deal, right? So then I was like, well, you know, the most natural thing would be to start a med spa. But I was like, this is about 2 years ago. And I was like, you know what? Seems like a lot more people are less interested in Western medicine. So like COVID had come and gone. There's like paranoia around like vaccines and Western medicine and all this kind of stuff. And people are trying to be holistic. And there's a lot of talk about like microplastics and all this kind of stuff, right? So I was like, you know, and the wellness word I had seen here and there a little bit, people weren't talking about it as much a couple of years ago. You know, it was more like in the functional medicine, longevity, regenerative space. So, you know, it wasn't a big thing. And so I was like, you know what? We should branch out into this kind of stuff that's more of a wellness thing. And you can call it a wellness center. It's like, look, we already have all these like hyperbaric red light and all these things are kind of wellness based. And we just would increase that stuff. So whether you call it a wellness thing or a med spa thing, I think there's a lot of overlap. And I think that there's a lot of cool technologies now that we didn't have before, like red lights, that not only, well, red lights have been around for a long time, but people are interested in it. So your consumers, your customers, your patients are interested in it, and it helps to kind of be part of the whole thing. And they don't cost a crazy amount of money. So you have to be smart about what's something cheap that I can bring in, what's something medium, what's something expensive. Because obviously, you know, when you're playing something with an expensive piece of equipment, it's a high stakes game that you're playing. You really got to nail it. But not everyone can do that. And a lot of people that are just getting into the space have to start a little bit lower. So I think thinking about what do your patients need and what works and kind of what do we think is cool in the zeitgeist and what people are talking about, I think was wellness. And so that's how I kind of got into this
Makes
stuff.
Perfect sense. And wellness has certainly been a topic for a long time. And wellness now means so many things, right? And I think the well-being of a patient post-surgery is super important. And you mentioned something that, you know, patients are wanting more. They're wanting to, of course, recover from surgery. They're more educated than they used to be. The Botox filler game is a tough one. But there's also this evolution of people wanting to look more natural. People are wanting to feel more natural. And that's also where this wellness thing is sort of kicking off. Are you seeing this whole concept of patients saying, hey, doc, I want surgery, but make me look natural? What does that mean to you? And what does that look like over the last few months? And what do you feel like it's going to be in the next few months ahead?
Yeah, so let's talk about it. I think you can think about this surgically and you can think about it non-surgically. Surgically, I think the best example of this is BBLs, right? So BBLs, about 10 years ago, people first started talking about it. About 5 years ago, they really peaked in kind of how popular they were. And I think what happens is like anything, there's a pendulum that swings back and forth and people want really big butts, big butts, big butts. And then the population sees all these big butts and they're like afraid of it. They're like, oh my God, this is not good. I don't want to look like that.
Right.
So then things swing back to like, well, I want a more natural look, not, you know, a butt that matches my body. This happened in the 90s with breast implants, right? So breast implants, bigger, 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 bigger. And then in the 2000s and 2010s, it started to get a little bit smaller. People want more natural. And it's just a pendulum that swings back and forth. It happens in the music industry. It happens in food, whatever, right? So I think with BBL, people still will come in, and it's funny because everyone comes in and everyone says that they want a natural look. They don't want to look like Kim Kardashian, but they'll show me another Kardashian's picture as a wish pick, and I'm like, all right, this is, you know. And a lot of people, even I tell them, I'm like, look, even Kim Kardashian doesn't want to look like that. And I usually tell them, like, look, it's going to take multiple rounds for you to get like a butt that's too big. So people do want less. They don't want that big, crazy kind of super large butt, but they still want plenty of butt. So what I find is that a lot of times when people say natural, us as plastic surgeons know, we just have to say like, well, what does natural mean to you? Because it means a lot of things to a lot of people. Very different, you know? So that's the thing where I think wish picks come in handy. And people will often tell me they're like, I want a natural look. This is kind of what I'm looking for. And I'll look at a wish pick that is AI or it's Photoshopped or it looks extreme to the majority of the population. So natural still means different things to different people. And there's still a lot of people out there that want an exaggerated look. Although a majority of people want it a little bit less exaggerated than before, because I think what happens is as something comes out and providers, whether it's injectors or surgeons or whatever, start to overdo it, you get this kind of crazy look. People get afraid of that and they think that everyone's going to look like that. But not everyone is. A good BBL, you're not going to know. Good makeup, you're not going to know. Fillers, Botox, good, you're not going to know, right? So I think what happens is same thing happens with fillers and stuff, right? So people see more pillow face, they see blown out looks and this and that. And you know, obviously this is a problem because if you're a provider and you're incentivized to make money by injecting more,
you're going to inject more, right?
That's right. So this is hard. So, you know, we try not to, you know, you don't want to incentivize based on injecting more. You want to incentivize on, let's say, for example, on repeat visits, right? So it's way better to, you know, instead of, you know, you do 1 or 2 syringes on one visit and have that person come back because they have a natural look that they love and they're coming back all the time, rather than you're like, we got to sell 4 syringes into their face or 5 syringes, blow them out. And then like they probably don't come back. Their friends may look at them weird, whatever, right? So I think what happens is we've seen a lot of Hollywood looking kind of crazy and people are afraid of that. And I think they think that 1 syringe of filler is going to give them that look, but really it's like, it's not going to give them that look. So people do want more natural. I think definitely in aesthetics, non-surgical, people want more natural that looks more normal. I think that's because a lot of stuff is on the face. And I've always said that with face, you want to be more conservative, and with body, you want to be more extreme. For example, when we do a tummy tuck or lipo, no one ever says that they're too skinny. You can make people as skinny as possible and they're going to still be like, but what about these ribs, right? But with the face, you can make people look too snatched or too weird or too whatever, right? So it's better to kind of underdo the face. So I think that, yes, people want more natural looks in the face because they've seen the pillow faces and they're more knowledgeable about it, whereas before they didn't. And I think the other thing that comes down to it is like, look at what your injector looks like too, right? So people self-select, right? So if your injector has really nice skin, nice cheeks, nice eyes,
that's
not a lot of
their
wrinkles,
mindset of what they would give you.
Yes, exactly. And it's what their taste is, right? So it's like, you wouldn't go to the Bentley dealership and ask for a Ferrari. You wouldn't go to a Ferrari dealership and ask for a Rolls Royce. But listen, a Rolls Royce is good for some people and a Ferrari is good for some people, right? But you have to see like, what dealership are you at? Who's selling what? What do they look like? What's their philosophy? And I think these days with seeing people online on Instagram, you can see how do they like to do things. And then you can go and get a taste of that and that kind of thing.
You can kind of see what resonates with you, what individual or what they're, because you're artists at the end of the day. And what does your art piece look like? And what sort of art piece are you going to give them? So that makes perfect sense. When it comes to natural, we know that people are demanding it. People are looking for it. But what are you seeing with individuals that have previously received surgery, let's just say a decade ago, that maybe were the overdone? When that pendulum was over here, when it was people were getting big butts, breast implants that were larger than usual. Are you starting to see people that are reducing, taking things out, reducing the work that they had previously?
Yes, I think you see this more in BBL. So the problem with BBL is that if you have a surgeon, so many surgeons just inject the butt, they don't inject the hips or the transition zone to the thigh. So you get this butt that's much bigger than the thigh. And that's what looks weird to the eye. That's where the mismatch comes from. Right. And then that person looks at that and they're like, oh, I want more butt. They don't understand it doesn't look good. They're like, I'll just go for round 2. But then the butt gets more big, right? And then inevitably what happens, because it's the US and everyone gains weight, they gain weight and then that butt exaggerates way bigger and the thigh doesn't match, right? So these are the people that come in and their butt's just kind of crazy big and they want like butt reduction. So definitely more people want BBL or butt reductions. It's not an easy surgery to do because making the patient happy is not easy. And the whole game of plastic surgery is making the patient happy. We know that we can always create a big difference. I can create a significant difference in everybody, but I don't know if I can make these people happy, you know? So that's what I'm always, whenever I'm in a consult, I'm always trying to think, can I make this person happy? Not can I?
And that's essentially what they're investing in. Is to feel better, right?
That's right.
And it's to get their confidence up. So that's actually very intriguing because you could do whatever it is, but are they going to like it?
Yeah, and it's tough because people who have come to have a big butt also enjoy the fact they have a big butt and they want a small butt at the same time. And you can't have both at the same time. So I liken it to like I'll tell them, like, look, this big butt is great. And it's kind of like Lamborghini. It's great for a Friday, Saturday night, and looks good at the club. But when you're going grocery shopping with that Lamborghini on a Wednesday and it's raining, you're like, I don't want to deal with this Lamborghini, right?
I love that.
But I'm like, so you want like an Aston Martin, right? So an Aston Martin, it's sporty, it's classic, it looks good at the club.
Daily driver.
That's right, daily drive it. You have to daily drive this butt, right? If you come in from a Lamborghini to an Aston Martin, there's going to be a certain level of disappointment. You have to understand that you cannot have that Lamborghini and the loud look anymore for Friday, Saturday night, because you have to understand that you're trying to actually get the majority of your life is not Friday and Saturday night, right?
There's a whole psychology to this.
Yeah, people always ask with plastic surgeons, they're like, do you have a psychologist at your office? And you're like, I am the psychologist, dude.
Right.
I am, you know? So it's a lot of it is like the words that we talk to patients and we're trying to understand them subjectively, what's in their head so that we can create something objectively, right? So when they say I want a big butt, natural, whatever, I'm trying to think how many cc's and milliliters this is. So I'm trying to take something subjective, look at pictures, this and that, their body, and think about objectively, how am I going to do this, right? The lipo BBL reduction, I typically don't do because it's very hard to make patients happy. The surgery is easy. It's a 30, 45-minute surgery, lipo that butt. But then it's 4 hours of hand-holding afterwards because the person's so sad they lost their butt. Right. But they came in to ask
lost
for that.
their Lamborghini.
I know, right? Because they're married and they have kids. They have an Aston Martin only. It's like, dude, an Aston Martin's awesome, you know? Right. But yes, we long for the Lamborghini days. You know what I mean?
Right.
So
that's a great way to put that. I didn't even realize that it was that sort of psychological in nature when it comes to, what they had to what they want. And then this sort of, they're letting go of their past, but then are they happy in their new body? There's so many layers to that. You mentioned also something else about when individuals gain weight, then things become, disproportionate. Speaking of weight, of course, GLP-1 has changed everything over the last several years. How has that impacted your line of work? Have you noticed any changes with what you do, and how do you deal with that?
Yeah, super interesting. Definitely has. Number one, surgery patients, we used to not get as much massive weight loss people. Now you're getting massive weight loss people way more than before. And the massive weight loss people who come in, they usually need like 4 different surgeries, usually a breast surgery, a tummy tuck, arms, and thighs, right? It used to be that they would come in and you would tell them like, look, you need these 4 surgeries. And they're like, oh, let me get this 1 or 2. My belly's what bothers me. Let's do this. And no one would end up doing like the brachioplasty or the thioplasty. Nowadays, people, they lose a lot of weight. They're online. They're looking around. They see good results and they're more knowledgeable. And they come in being like, I want the arm lift. I want the thigh lift. These things that we used to not do as much because people were worried about the scar or whatever, they see the benefits of it. And the taboo is a little bit less because more people are getting it, all that. Yeah. So on the surgery side of things, more massive weight loss, more of these multiple surgeries, less convincing of patients. What happens, patients would come in and be like, they'd have a super saggy arm and they'd be like, can I just get lipo? And you're like, oh, we have to have this talk. You need an arm lift and you need this scar. It was this whole talk, this whole thing, and they'd be all disappointed because they got to get a scar or whatever. Now they come in like, I want that thing. I know about it. I want the brachioplasty, the arm lift, right? So on the surgery side of things, that's been kind of cool. And massive weight loss patients are actually great patients because they've had to have the discipline of doing the gym and losing the weight. So by the time it comes to like having the discipline of recovering and following all your orders, they do it. It's awesome, right? The other interesting thing is that there's this class of patients who have lost 20 to 30 pounds, which are not massive weight loss, but their skin gets stretchy. Right. And we've had to think of ways of non-surgical tightening or minimally invasive stuff to help with this. Sometimes this is J-plasma, sometimes this is RF microneedling. An interesting surgery that we've had to dust off that nobody really did for a long time was something called a reverse tummy tuck. And what this is that it's for the upper abdomen. So basically you remove a bit of skin under the breast, you raise up the upper abdomen a couple inches, and it smooths out the upper abdomen. Who is this good for? People that we never had before, which was like women who had not had children, who had laxity in the upper abdomen, but it wasn't bad enough to need a tummy tuck. We're not trying to do a tummy tuck until they're done having children. Or people who, they'd come in, they look great, but they've lost 20, 30 pounds. They're a little laxity. We do lipo on them and everything sags in a way that it shouldn't really, but they have this like kind of history thing. And it's like, we have to dust off this old surgery and start doing it way more. So me and my other plastic surgery friends have been doing the surgery more, and it's just interesting. And I think that the blend to like aesthetics comes to like muscle building with like M-Sculpt and that kind of thing is a big deal. When to revive patients after they've kind of lost muscle and stuff. And then I think all the non-surgical stuff is going to be bigger and doing and revolumizing the face because people lose weight quickly. It's not the problem that they lose weight, it's that they lose it quickly. If you lost 50 pounds over 2 years, like you'd be okay.
Right.
Over
when
3
people
years.
are losing in 2 months, you look strange.
That's right. Because your body just kind of dumps all that fat, right? It's very hard to stay with something and lose 50 pounds over 2-3 years. The reason GLPs work great is because people are like, oh my God, I'm dropping all this weight. I'm so excited. I can stay on my gym. I can stay on my thing. They're excited. People want to see that weight dropping fast. Right. So I think it's hard to get people to lose weight slowly because everyone wants to see it faster. And if you lose it slowly, you're not as motivated. You don't stick with it. And so we have this situation where like I said, you have mildly stretchy skin, which we have to think of non-invasive or non-surgical ways or mildly surgical ways to do it. You have more of the massive weight loss people. So, and I think that's only going to increase because GLP-1s, I mean, obviously we know they're super popular, but we're continuously finding more benefits of them for like longevity and anti-dementia and all this kind of stuff, right?
Absolutely. This whole body contouring concept is becoming bigger, not just because of surgery, what you've been doing, this reverse tummy tuck, which is very interesting. And then of course the GLP-1 craze and all this stuff. There's many options on non-invasive body contouring, but there's this new thing, rib reduction. It's something that is new. It's something that I don't know anything about. And it's something that you're one of the first or if the first in Chicago to do it. There's going to be lines out the door for your office for consultations to get this surgery. Can you give us a little insight on what this is?
Yeah. So let's call it rib remodeling, right? Okay. So the confusion is that we always knew about rib removal, right? And there's like a lot of jokes going back way along to the 90s about like rib removal and stuff like that. And rib removal was basically you'd make these incisions in the lower back. You'd remove the ribs 11 and 12, the floating ribs, and you'd have these little scars and the waist get a little bit smaller.
Just completely remove them.
You'd remove them totally, yeah, except for like what's connected to the spine, basically, yeah. To me, I always saw that stuff, and I thought, number one, it's really extreme, and we're not getting a big, significant cosmetic difference for it. So when you want a good plastic surgery, something good to do, you want something that's not extreme. You want to get a significant difference. You want to have low recovery. You want to have low complications. You want to have a lot of happy patients, right? So I found that with rib removal, and I'd see it wasn't really like hitting, the way that we would want for patients. 5 to 10 years ago or so, in South America and Russia, they started doing more called rib remodeling, which is basically making a microfracture in ribs 10, 11, 12, the bottom ones, close to the spine, about 7 centimeters off the spine. And what you do is you're creating a green stick fracture and you're infracturing those ribs.
Interesting.
Yeah. So it's a monocortical. So you're not burrowing through the whole thing. Right. You hit one side of it and it weakens it, and then you just push on it and it cracks in, right? It can take 4 inches off the waist.
Wow.
And that's huge. That's huge, especially for a lot of women who are skinny. Right. So a lot of women who are skinny, you've done lipo once or twice, they want to get a narrow waist, or they have wider ribs and like you can't get them much smaller. And I would tell them, I'd be like, look, I can't get your ribs or muscles any smaller, but this is one way you can do that. And it only takes an hour in the OR. If you're really facile with it, it takes even less than that, like 30 minutes or so. And people do have to wear a corset for 3 months afterwards, right? Day and night, because that is what shapes it, right? So it's kind of like wearing a cast.
It has to heal in that sort of format.
That's exactly it. Right. So the women can tighten it to kind of the degree that they want. So let's say they tighten it down to 3 inches. They like 3 inches of waist removal.
So it's customized.
They can customize it. That's right. Okay, now, knowing people, everyone's going to want to get as skinny as possible. Okay. So the cool thing is it's definitely less extreme than rib removal. There's essentially no scars because you're using ultrasound and little needle to poke hole back there.
The recovery is probably relatively faster.
A lot of people say it doesn't even feel like any pain at all.
Oh, wow.
Which is crazy. I think it's probably because 11 and 12 don't have a neurovascular bundle. Right. 10 does. You're not really messing with like the nerves that much. Sure. You do have to wear the corset kind of all the time, but it does seem like the next level of things. So I kept an eye on it for the last year or so as it's been in the US. Yep. And we're always trying to level up. You never want to be that surgeon who's 30 years in doing the same things you did 30 years ago.
Hey, you're staying ahead of it.
Have to. Yeah. So I went and got the certification, the training, the hands-on and all that stuff just last week, actually. And so we're going to be offering that this summer, and that's going to be awesome. The next level of stuff.
I love that. And I think that, science is crazy. And it's beautiful to see that even plastic surgery is continuously evolving. We see evolution in aesthetics, and we see evolution in wellness and all these other peptides. But to have surgery evolve, when you think, oh, surgery it's done, right? We have our standard of surgery, but to see it continuously evolving, but also you're bringing it in, that's fascinating. I want to move to another topic. This whole before and after concept. We know social media is on the rise. And, you and I both are doing our best efforts to get ahead of it and be on social media because we know that it's the way of the world, right? I mean, newspapers are gone, and who watches television anymore in terms of, commercials. So we know that people are accessing the websites and also social media, TikTok, Instagram, and so forth to get information, specifically to see how patients' results look like. And of course, in your field, it's so important. Yeah. As we mentioned earlier, you're an artist. So people want to say, okay, hey, what did it look like before and what does it look like after? With before and afters, how important are they in what you do? Do you feel like they are helpful? Do you feel like they're harmful? What is your take on sort of before and afters and the trend increasing now that we have this access with our phones and social media, and you be able to highlight this, but also other surgical practices around the world highlighting it. What is the good and bad?
Yeah, this is something we think about a lot as plastic surgeons, and different plastic surgeons feel differently about this. We call them wish picks, what they want a wish to look like. I think that having a few wish picks is helpful because it takes that objective thing and makes it subjective, right? Or subjective and objective, meaning that when a patient comes in, they say they want to look natural, they don't want a butt that's too big. I'm like, just show me the photos. What does too big mean to you? What does too small look to you, right? And the best thing is if they look at your gallery and they're giving you photos from your own gallery and your own patients of this is too big, this is too small, I love this, I love this, I love this. So then you know, okay, what I did for that patient, I can do for this patient, right? And they know your style because every surgeon is like a different chef or a different artist. Like they just have different genres of food or whatever they create, right? Some guys make big butts, some people small, some people natural, whatever, right? It's good when they can show you that. I think that is super helpful. 3-4 wish picks, helpful. It shows that they're paying attention. They also understand that like their body is going to be different. This is always a good thing when they say that, look, I know that my body's different and we can compare and contrast those wish picks. I think the tough thing happens when people bring in like 10 wish picks or a whole mood board or Pinterest board or something, because a lot of these folks are very obsessive over that final result. And that final result is going to be a goalpost that keeps moving. So I've been in many situations where I've delivered exactly like an amalgamation of the 3 different wish picks they gave me. And they were like, I kind of want this. And so the goalpost moves. And I'm like, I'm thinking to myself, you know how hard it is to give you exactly like the amalgamation of the 3 things. But sometimes we have to talk to patients and be like, look, when there's 10 wish picks, like you're not going to look like any of these people. You're going to look like your version of this. And this is what we're going to do. And this is what we can do. And this is what we can't do, you know? And also stuff like we can control how much fat we put in the butt. You can control not sitting on it, but we can't control how much it's going to reabsorb. That's just, I always say, I'm like, that's just up to like your blood flow and God and like what they want for you. You know what I mean? And so that's kind of how traditionally it's always been with wish picks. Some people don't like them at all. Some people like a little bit, a lot. I think, you know, a few of them is helpful because it helps me to understand what the patient thinks is big, natural, not natural. So in the last 10 years, we would have to deal with kind of photoshopped wish picks, right? So like stuff that was very simple. People would have a photo of them on Instagram, or a model would have a photo of her on Instagram and use an app to just make herself more skinny. And then a patient would take that and think that's reality and bring it in and be like, I want to look like this. And I'm like, that person doesn't even look like that.
Right.
You know? And then
so that happens. People bring in things thinking it's real. And then you're like, there's no way that's real.
100%. And us as plastic surgeons we can look at this stuff and we're like, okay, that's not real. That's not real. That looks like this. This looks fake. Like people are not like this. So because we deal with human bodies all the time, we're like, there's no way these proportions are real, or you can see the touching up, and we have to deal with it all the time, right? So we have a sixth sense, we have to sniff it out. In the last year or two, AI is now popping up, right? So I'm getting wish pics of AI people, and you can tell because it kind of looks cartoony. And I'm like, not only does that person not look like that, I used to say like that girl doesn't look like that. Now I have to say like that person doesn't even exist.
Right.
You know,
not unreal.
That's right. So if you're getting someone who has a lot of AI, 10 AI wish pics, it's better just to turn down that patient for sure. And this is a lot easier said than done when you're actually in that room and telling that person, because that person thinks this is normal and natural and these people look like this, and they think that plastic surgery is a magic wand that will give them this. But a lot of it comes down to where's their body starting, where can we get to? So a lot of times everyone will give you wish pics of people who are 21, 22 BMI, Kylie Jenner. They're like, I want to look like this, good and natural. But they are 28, 29, 30 BMI, and there's enough visceral fat and organs and ribs.
Right. There's so many different factors there.
That's right. And there's like stuff like, you know, you can take 5-6 liters out in one lipo case, but this person has 12 liters around their body that's different than that person. So you have to make them understand that. That's one thing. I think that has actually been helpful in the last few years, that people do more plastic surgery, they do more BBLs, people go through this process, they get online, they educate each other, patients will educate each other, and there's been some more realistic stuff. People are more realistic when they come in. I think part of this comes down to the image that you're putting out on social media. So I try to be very honest and transparent and not glitzy on social media. I try to be very like, keep it real. I do Q&As every other week where people can just submit questions and I just answer all the questions, and we talk for an hour about everything. I try to just keep it real. If you keep it real and be authentic with people, then they understand. I think this is important both in aesthetics, non-surgical, and surgical. There's so much BS. You know this. There's so much BS. There's so much snake oil. There's so much gray area. There's very few things that are black or white. And if you talk to 10 different people, they're going to tell you 10 different things, you know? So I try to shed light on what's gray area. And I try to do it like a conversation that I'm having with friends. So usually I'll have a drink and I'll get on the Q&A and I'll be like, let's get this question. I'll be like, look, this is what I would tell. If this question came up and me and my plastic surgeon friend were talking about this is how we would answer it. I'd be like, dude, that's crazy. That's never going to happen. Or like, oh, that's rare. That, you know, but it can happen. So that people understand that this thing is rare, not going to happen. This thing is common, could happen. This is how things really are. And so we can talk about like wish pics and we can talk about all this kind of stuff.
Do you feel like AI is going to enhance or give you more capabilities of showing patients their transformation? Because there's, of course, a lot of these sort of augmented things, these scanners for faces, for example, where they have their current image and then saying, hypothetically, if we were to add, 2 cc's of filler or whatever, this is kind of what we're looking for. So they're looking at themselves rather than this wish pick. Now they're seeing kind of an augmented version of themselves. Do you have that in the horizon? Do you see that becoming a thing? How is an imagery of AI going to impact kind of what you do or what the future looks like?
Yeah, so I think it'll work better in some ways than others. I think for breast, it's closer to working similarly. I think the technology I've seen out there, and it's been around for a while, Vectra is one company that for 10 years at least we've seen that stuff out there. They're pretty good at augmenting a breast and showing you what that would look like with 200 cc's, 300 cc's more. They're not as good with like lifting a breast and giving you an idea there, Sure. Maybe as a surgeon, you can tweak those controls and be like, look, this is what I think I can give you. You'd kind of tweak the nipple and stuff like that. I think with nose, it's doable because you can get good side photos of the nose and show kind of a photoshopped or whatever image that you want. So I think that's helpful. I think they're helpful for discussion of what we think we can get and what is that patient like. Do you think this nose is good? Do you think this breast is too big, too small? Oh, I like this. Okay, I think, and for discussion purposes. I think it's harder for butt and belly and that kind of thing because there's so, like a Photoshop or an AI is going to look at that. They're not going to understand there's ribs there that you can't reduce. And it's just going to like formulaically be like, okay, we're just going to reduce this 3 inches. But it's like in some people, they have a lot of fat and you can reduce them a lot. Some people have little fat, lot wide ribs. You can't really reduce them, right? So I think that's going to still take a while. We know this stuff has grown like crazy. What could happen in the future? I think what would be awesome is if I could take my, 700 photos of before and afters and train an AI model on my Dr. Azizi results.
That's cool.
Right? And then you put just a good abdomen, like an AP or lateral or oblique photo, and it knows what can Dr. Azizi do, and then it can kind of give us something like that. I think that it's going to be able to, create something that's super cool. Are we 5 years away from that? 4 years, 3 years? Probably, but I think that's kind of cool.
Absolutely. It's going to learn your style. It's going to understand, hey, what is your sort of artistic abilities? Let's apply that algorithm to this patient and see what could be developed there. Last couple of questions for you. When it comes to emerging trends, what are some of the surgeries and procedures that you absolutely love doing, your favorites? And I know you do a lot, so it's hard. It's like asking who's your favorite kid, but what's the one surgery that you feel like you're either the best at or you enjoy the most? And on the flip side of it, what are some things you just don't care for? You're like, oh, these are ridiculous trends that are happening out there. These are aesthetic sort of trending things that are just ridiculous. I would love to hear both takes of what are the things that are, I love it. It's never going away. I thoroughly love doing this. And then I don't really care for this. This is ridiculous. Yeah. All right. So love it, never going away. Lipo BBL, right? So people think BBL is a new thing, but the way I see it is I think that Lipo 360 BBL is an advancement. It's the next level of liposuction. So liposuction was always the largest amount of, the highest population of people getting plastic surgery were getting lipo. It was like the number one procedure, right? And then once we learned to fat graft and transfer this fat, it just became an evolution of lipo. So that the majority of people coming in who would still be getting lipo, 90% of them have something about their butt or their breast that they don't like. And it's like, well, we got this fat and we can transfer it. So I think that's why BBL is such a popular thing, because it's just an evolution of the lipo that we were doing before, but we were just doing it better because we can transfer the fat. Right. So I think that's not going to go anywhere. And like we were saying with the pendulum thing, that it's just going to swing back and forth. Smaller butts, bigger butts, natural, smaller hips, skinny BBL, bigger hips, whatever, right? So I think that's just going to go back and forth, just like how breast implants. Breast implants have now been around for, let's say, 30 years heavily. Bigger implants, smaller implants, but big implants aren't going away. Small implants aren't going away. It's just a matter of each person's personal style, right? So I think those things aren't going away. I love doing lipo BBL. The advanced techniques are high definition liposuction, injecting in certain muscle groups to actually improve definition. So a big thing is like injecting in, like for men, you can inject the deltoid, you can inject the pec, you can inject triceps to create this like V shape. And what's interesting is that it's not the fat that necessarily stays. A year later, they've done MRIs and seen that the fat is gone, but the muscle's actually grown. So there's got to be a stem cell effect there that's doing it. And that's awesome. You can create these crazy bodies on men, really in a good way that also looks natural. Why? Because you're augmenting the muscle. You can do it in abs. So you can inject a little bit of fat in the abs, and the abs pop more, but because it's your muscle popping, it actually tends to look good. That's kind of like the next level of stuff. Rib remodeling we talked about, people are always going to be trying to get skinnier. So I think lipo BBL is never going away. Breast implants aren't going away, even if people talk about breast implant illness, and that's a whole nother discussion itself, but that's a very kind of rare thing. The stuff that I think that kind of has come and gone, buccal fat pad removal, 5 years ago or so, this was like super popular, and in facelift surgeons would take out the buccal fat pad. And the whole thing with the fat in the face is that you lose fat over time. So should we really remove it early on because you're going to need it later? But try telling that to a 25-year-old girl who's got a thicker face, right? And she wants to be snatched, right? Look like someone online. What I found, so I did some buccal fat pad removal, and it's one of these things that I had to just kind of learn to do it after my training because trends can come and go. And I was like, oh, this looks like a good surgery. The problem with this was that people want a skinny snatched face, and you can only take out like say 2-3 cc's of buccal fat pad, maybe 5 cc's to create a difference. But if you take more than that, you're going to injure the nerve, you're going to injure the salivary ducts.
it's going to be a problem. But people, what I found was they wanted more of a look than you could deliver safely for them. I think that's where there was a disconnect between what patients want to make them happy and what surgery can actually deliver. People who started doing buccal fat pad removal saw the same thing. And this happens a lot with face surgeries. Face surgeries are kind of like that, where patients want a dramatic difference, but either due to taste of yourself as a surgeon, you're trying to not create a dramatic difference. Like dramatic difference in the facelift, good. Dramatic difference in kind of eyelids, not good.
Right.
You know what I mean? Pull the neck tight, love it. Pull the face tight, not as good, right? So you're trying to balance this thing. And patients kind of want that extreme look, but you can't put a 25-year-old person's face on a 60-year-old. It's just not going to look right. You know, you want a refreshed version of that. So I think buccal fat pad removal kind of came and went. I don't think it's going to go anywhere. I think people are going to still keep doing it. I think it'll still be around, but I think that people are understanding that there's limitations in how much it's going to, so to speak, snatch your face. Funny part is you can talk to people. Talk to a 25-year-old woman who wants the buccal fat pad removal, and you're like, look, you're maybe going to need this 40 years from now or whatever. They're like, dude, whatever.
Right.
I'll be married or dead or whatever by that point. Like, just take it out now. You know, so it's hard to convince that person at 25 years old what that 50-year-old thing is going to be. So you just, okay, well,
once again, it goes back to the whole psychology, right? Is having almost a conversation and hey, I know you want these results, but like emotionally, we have to also understand and fast forward a few decades from now what that's going to impact look like.
Yeah.
I love this. One question that I promised you I would not ask more. I'm going to ask one more. I break my promise, and it's because you inspired me with this whole concept of men. You know, men have always kind of been this non-aesthetic sort of connoisseur, right? It's always been women, heavy industry, but we're starting to see more men kind of come out into the concept of what can I do to age more gracefully? What can I do to balance hormones as a result in my world? But also cosmetically, what can I do to continue to achieve, a nice jawline or a physique that, is matching up to the women counterparts? Are you seeing more men come into practice? Are you kind of seeing that trend go in an upward direction when it comes to more men coming in with interest of, hey, I want to do these things now, which before kind of was not an existent area?
Yeah, I think it's when taboos and thresholds to get things decrease and taboos decrease, people start getting more stuff. I think the reason that women have always done more things is because women are used to makeup, getting waxed, nails, hair, and it's just a small jump to then do Botox fillers, and then it's just a small jump to like maybe do surgery because they're already taking care of themselves, already going to the gyne or the OB all the time, and men are not seeing doctors, so they're not seeing anything. I mean, men will get haircuts and nothing else, and that's it, right? So there's no other there's that threshold to jump, and then there's more taboo for men doing that. So I think what happens is, as men do more GLP-1s and they lose weight, it becomes a thing like, okay, I'm going to the aesthetic person, I'm making myself better, I'm regenerating, oh, we're doing hormones, we're just getting our testosterone back to what it was before, we're just regenerating, and then the next jump is like, well, I guess they got Botox. Okay, my wife said I got some wrinkles. Maybe I should do it. That ends up, the threshold lowers, taboo decreases. And so people start doing more non-surgical. And then they're like, well, maybe I'll just do the M sculpt and the muscle work. And so they'll do that. And so then I think what then will happen is jumping into like the surgeries, right? Some people are forced into it because they have massive weight loss and they lose a ton of weight and then they have to do it, right? In other countries where there's less taboo, there's definitely more developing and creating these amazing killer kind of men's bodies with like the muscle fat grafting and high definition lipo and six packs and all this kind of stuff. Because there's less taboo in other countries, people are actually more fit, so they're better candidates for plastic surgery. In the US, people are less fit. A lot of dudes are 30, 35 BMI. They're not a good candidate for plastic surgery, and they're not going to maintain those results. So like, it's not like the best milieu or ecosystem for plastic surgery. But I think that yes, it's happening more. More guys are doing it. There's more like men's surgery clinics that are popping up, or guys that specialize in men's surgery.
Oh, really? Okay.
Yeah, and they cater to that. And it's funny because if you talk to the guys who specialize in men's surgery, they're like, I hate working on women. It's so annoying. Men are so easy. And if you work on, if you're the guy who works on women, like I work primarily on women, you're like, I hate working on men. They're so annoying. So just like everyone just kind of falls into what flavor of ice cream that they like to eat. You know what I mean? Definitely taboos are lowering. It's going to happen more. And I think 10 years from now, it's going to be even more. And 20 years from now, it's going to probably be way more.
I might come see you. Who knows? We'll see. Well, I would like to kind of hear just open thoughts, anything that's been on your mind, anything that you feel like people need to be aware of, things that you would probably want to, kind of put on the horizon for individuals to know in your space. I think that a lot of attention's always been on the injectors and the wellness space. And I loved having you on this because I think that there's so much to learn still in the world of surgery, and plastic surgery has always just been there. It's always been stable. And it's, social media certainly has emphasized a lot more of the Botox, the fillers. People are, like you said, everyone's doing it, right? We have family medicine doctors, dentists, nurse practitioners, everyone's getting into the non-invasive or minimally invasive game. But as a surgeon, is there anything that, that's on your mind that you feel you want to depart us with, some knowledge of, hey, surgery is still important. It's not something that people should fear or whatever is on your mind as a plastic surgeon that you want to tell the world.
All right, I'll take this a little adjacent to what you were asking, because I was thinking about it as you were saying that. I'm going to say it for stuff that I'd want patients to know and stuff that I'd want my fellow clinicians to know, right? Patients, I think doing your research is more important than ever. Okay. Yep. That thing we were talking about, like there's so much gray area. There's not a lot that's black and white. I think do not get fooled by the glitz and glam of the marketing of some people, because there's a lot of places that have very poor patient customer service and they don't take care of patients and they're just churning through patients, but they have amazing marketing. Things look super slick online. So go do your research, review as much as you can. If you have a friend who's gone someone, that's always helpful too. So I think that's more important than ever. Follow someone for 6 months, a year, whatever, before you're doing that surgery. I think that will always be a thing. Like I can tell you about a trend or this and that or cool, whatever, but like do your research, because if you go to someone who's reputable and who cares about you as a person, as a patient, whatever they're doing is going to be good for you. Right. For my fellow clinicians, I would say you got to learn the business stuff, right? The biggest difference I have no business training. I came out, no business training. I took a loan. I started my practice. I took it one day at a time and just tried to grow it. I think I was like the youngest guy in Chicago to have his own surgery center and buy his building and all this kind of stuff. And I did that by just trying to learn every day. And there's so much knowledge in books and podcasts these days, right? Mm-hmm. Books that I would recommend, you got to read all the time. I read every day. I'll try to read an hour a day if I can in the morning when I'll have my coffee. But if you can at least get 10 pages in every day, I think for my fellow clinicians is awesome. Books to read. I was thinking about this. I was like, Good to Great by Jim Collins.
Classic.
Amazing.
Yep.
And here's the thing, the business people know this. The medical people do not know this kind of stuff. But even if you have never heard of these books, so Good to Great by Jim Collins, amazing. Talks about the top companies over a long period of time and what took them from being average to great. And it's awesome. You can apply it in your own clinic in a lot of ways and open your mind. Traction is super important about systems. It talks about the entrepreneurial operating system. This is really good for creating systems. And even if it's like these systems are so crazy far ahead of you, at least it gets you thinking that way. I think that's really good. The Obstacle is the Way is something that I recommend often. It is a book on stoicism. This is, if I had to recommend, but I read a ton, and this is the one book I would say, read this first. The Obstacle is the Way. And basically it talks about Marcus Aurelius, all the Stoics, and all the idea that life is difficult. You can only control yourself. You can only control the way that you see things. Right. And when you read this book, you realize that like all the difficult things we deal with are just life, right? And we know this, but when you read the book, it really makes much more sense to you. Can't remember the author's name right now, but I've read like multiple of his books, so it kills me that I can't remember his name. But that's an awesome one. It's just a very easy primer. And then the other good business book, I've read a lot of business book, one called Your Next 5 Moves by Patrick Bet-David. The reason I like this book, I like Patrick Bet-David. I think he's really like authentic and no nonsense. The reason I like this book is that I had read all these business books and I read this book and I was like, this just kind of puts everything together. Yep. Super actionable, really easy to read. So I'm like, read that, because then you can get into the other nerdy books that are more specific or whatever, Kind
of PhD level. It's a lot. It could be overwhelming. It's like, there's no way I can do this.
Yeah.
So no, definitely.
That's what I would say. And there's so many podcasts. I mean, look, I love Alex Hormozi. I love Andy Frisella.
Of course.
Sam puts out killer stuff, dude. That's why I'm here. I just
appreciate that.
Yeah, for real. There's a lot of great podcasts. I think just, if you're in your car all the time, use it as a library. At home, read. And because you can level up yourself and your clinic and your people and everything. And if you're the leader of that clinic, you have to be like the mindset person. You have to be the motivational speaker for the whole place. It's like it comes from the top. And if you're average, your people are going to be average. And if you push yourself to be top 10%, then your people will push themselves to be top 10%, and you'll attract people to come be part of something special. And it's like in this game, it's competitive. You have to be top 10%. You can't just be average. Otherwise, you're going to get washed out in the masses. And also, we're dealing with people, right? So we're doctors, we're physicians, we're dealing with people. This is a higher calling. It's like when I always say, I'm like, look, I love coffee, but if you're working at Starbucks and you burn the coffee one day, no big deal. People come back the next day, no big deal. Right. If you burn a body, you burn a person or whatever, not literally, but whatever. These are people. These are important things. These people spend a lot of money. It's their hopes and dreams are tied up into this thing, and it's a big deal for them. So I think we have to treat them with dignity and respect. And I think being top level and pushing yourself to be top level and constantly working to level up yourself is super important, because the people around you be leveled up, your patients will thank you for it, and you'll show up better for everybody.
If you want to see a top level plastic surgeon, I don't know what else you all need to be convinced. I mean, it got me convinced. I think that we have one of the best, if not the best, in Chicago. Dr. Azizi, it's been a pleasure. How can people find you?
Probably Dr. Azizi Chicago is the best way. Instagram, that's probably where I'm most active. DrAzizi Chicago. Dr. Azizi Chicago on TikTok.
Listen, I appreciate your time. I know you're a busy guy and your time is precious, and I appreciate you spending it with me and with our viewers. Of course, make sure you follow Dr. Azizi, because there's so much to learn. But also, if you want to get a little touch up here and there, you know who to go to. There's no one better. I appreciate all of you. If you're new, make sure you hit subscribe before exiting the video, and I'll look forward to seeing you guys real soon. Dr. Azizi, it's a pleasure having you. Thank you.
Honor and pleasure, man. Thank you so much. I appreciate it.